Silverlon. Performance, power, speed. Introducing Silverlon Lifesaver IV Catheter Discs, a 7-day silver-plated antimicrobial dressing. The following section provides step-by-step instruction on product use techniques, procedures, and protocols necessary to ensure proper compliance. These recommendations of use should be used in conjunction with your facility's standard protocols on dressing changes. Prior to applying the Silverlon dressing, the patient's catheter should be inserted following your facility's best practices protocol. To get started, remove the Silverlon catheter dressing using aseptic technique, laying it flat with the silver side up. Step 1 is activation. With the pad exposed, use a flush syringe to hydrate the dressing. Begin by starting the flow of liquid off the sterile field. Next, while avoiding direct contact with the surface, deliver the liquid by moving back and forth, completely hydrating the dressing. The dressing may visibly darken as it takes on moisture. To avoid oversaturation, the dressing should not become dripping wet. The second step is application. With the Silverlon dressing fully activated, gently place it around the catheter with the white surface facing up, silver side down. The silver side must be in contact with the skin. Simply open the radial slit and place the dressing onto the patient's skin, silver side down, being sure to center the inner circle on the catheter insertion site. For optimal efficacy, make sure the slit edges completely close. Silverlon's silver-plated technology creates a large reservoir of pure silver, generating silver ions continuously for up to 7 days with no risk of staining or stinging. The last step is to secure the dressing. Place the transparent sterile dressing of your choice over the insertion site to anchor the device. For catheter dressing changes, first, assemble the appropriate equipment including the CVC dressing kit, needleless connectors, flushes, and disinfectant caps. Next, be sure to practice proper hand hygiene. Then open the outer cover of the dressing tray. Place a mask on yourself and place one on the patient. Wearing non-sterile, clean gloves, stabilize the exposed portion of the catheter with one hand anchoring the device. Then remove the old dressing and steri strips if used. Be careful not to dislodge the catheter. To remove, gently lift a corner of the dressing's adhesive edge while pressing down on the skin. If there is difficulty starting the adhesive removal, apply tape to the edge and gently lift to begin to separate from the skin. While gently holding down the center of the dressing, grasp the edge and pull it straight out parallel to the skin to stretch, releasing the adhesion as you go. Continue this technique of stretching to release the adhesive around the entire dressing. When dressing removal is complete, dispose of the dirty gloves. To cleanse the catheter site, start by opening the inner cover tray to use as a sterile field. Next, wearing sterile gloves, cleanse around catheter insertion site with CHG, chlorhexidine gluconate, for a 30-second friction rub in a crisscross, not circular pattern, or follow manufacturer's instructions. Apply skin prep as needed to outer area and assure that skin has completely dried. Now that the catheter site has been properly cleansed, complete the dressing change by activating and applying the Silverlon catheter disc per the step-by-step instructions covered earlier in this video. Silverlon generates enough silver ions to eradicate MRSA in the dressing in 4 hours and remains active for up to 7 days. Apply the Silverlon catheter dressing on the site with the silver side down. Secure with a transparent dressing over the insertion site, anchoring the device. And finally, label dressing with date, time, and initials. To complete the full dressing change, perform hand hygiene after labeling. Be sure to follow your facility's protocol for complete instructions on all catheter change procedures. With Silverlon dressings, the advantages are clear. Silverlon. Performance, power, speed.